Discover the top 9 foods to prevent stroke you should remember. Stroke can have severe health consequences, ranging from brain damage to heart failure and even death. However, there are many ways to prevent it. In this video, we will explore the 9 best foods for stroke prevention. The risk of stroke can increase due to factors such as high blood pressure, diabetes, and high cholesterol. Fortunately, we can address these risks by adjusting our daily diet. Let's dive into the top 9 stroke-preventing foods in the article below. Don't forget to like the video and subscribe to the channel for more healthcare tips. What is a stroke? A stroke is a type of medical condition affecting the brain's vascular system. It occurs when a part of the brain doesn't receive enough blood and nutrients due to a blockage or bleeding in the blood vessels supplying that area. Different types of strokes can cause a range of challenging complications for patients, including paralysis, physical weakness, impaired mobility, difficulty swallowing, and vision loss. Additionally, strokes can lead to emotional disorders, communication challenges, or even depression. In severe cases, if not detected and treated promptly, a stroke can result in death or leave the patient in a vegetative state for life. Number 1. Sweet potato leaves. Sweet potatoes are known for their high fiber content and strong antioxidant properties. Consuming sweet potatoes can aid in weight loss, protect the body from bad cholesterol, and prevent strokes. Sweet potato leaves, in particular, are one of the best foods for stroke prevention. Sweet potato leaves are commonly used in summer dishes. While the plant is traditionally cultivated for its tubers, the leaves were once considered a cheap, nutritionally insignificant green vegetable. Recently, however, they have gained popularity due to their numerous health benefits. Modern medical research has shown that sweet potato leaves are far more nutrient-rich than the tubers themselves. For example, vitamin B6 in the leaves is 3 times higher, vitamin C is 5 times higher, and riboflavin is 10 times higher compared to the tubers. Notably, compared to other leafy vegetables, sweet potato leaves contain significantly lower levels of oxalic acid, reducing the risk of kidney stones. Cardiovascular and stroke prevention. Scientists have discovered that lutein and zeaxanthin, compounds found in sweet potato leaves, play a crucial role in preventing coronary artery disease and strokes. Experimental evidence indicates that lutein derived from sweet potato leaves significantly lowers bad cholesterol levels and arterial walls. Number 2. Broccoli. This vegetable has been found to not only combat cancer but also help treat strokes. A recent study published in the scientific journal ACS Central Science revealed another remarkable benefit of broccoli, beyond its cancer-fighting properties. The anti-cancer compounds in broccoli can also prevent and treat blood clots, known to cause strokes, which are currently the second leading cause of death globally, according to Science Alert. Scientists from the University of Sydney in Australia conducted a series of laboratory experiments on 23 plant-based compounds to determine their effects on blood platelets. Platelets play a critical role in sealing wounds to stop bleeding, but are also responsible for forming dangerous clots that can block blood flow. In vital organs like the brain and heart, every second of oxygen deprivation can cause irreparable damage. The study found that sulforaphane, SFN, a compound commonly found in cruciferous vegetables like broccoli, cauliflower, and broccoli sprouts, stands out for its anti-clotting properties, according to Science Alert. This compound has already gained attention for its ability to prevent cancer and lower cholesterol. A detailed molecular analysis of SFN's effects revealed that it slows platelet aggregation and inhibits clot formation in arteries. Dr. Xiyu Liu, a biomedical scientist from the University of Sydney, explained, "The compound in broccoli not only enhances the efficacy of clot-busting drugs post-stroke, but can also be used as a preventative measure for patients at high risk of stroke." These findings suggest that SFN is highly promising as a method to reduce stroke risks in the most vulnerable populations, especially since it is readily available in broccoli, which is already known to promote heart health and protect against disease. SFN may also have emergency applications. It could be used as a treatment for stroke patients to minimize brain damage. Such treatments could significantly reduce the harm caused by blood clots and ultimately save lives. Current clot-dissolving drugs, known as tissue plasminogen activators, TPA, only offer about 20% protection against brain damage. However, in mouse experiments, researchers found that combining TPA with SFN from broccoli increased the success rate to 60%, according to Science Alert. Dr. Liu added, "Interestingly, while blood thinners tested for stroke treatment often have the side effect of causing bleeding, SFN showed no signs of bleeding risks." Number 3. Other dark green leafy vegetables. First, Focus on dark green leafy vegetables, foods rich in fiber, low in fat, and low in calories. Meals that include dark green leafy vegetables can help control body weight and maintain stable blood pressure. Examples include water spinach, sweet leaf, jute leaves, kale, and broccoli. Green vegetables are low in fat and calories but high in fiber and other nutrients such as vitamin A, vitamin C, potassium, and folate. In addition to combating homocysteine, an amino acid associated with heart disease, folate can also protect against hemorrhagic stroke, a type of stroke caused by brain bleeding. Researchers at Umeå University in Sweden discovered that folate, a B vitamin found in leafy greens, fruits, and dried beans, reduces the risk of hemorrhagic stroke. Folate metabolism has been shown to lower the risk of hemorrhagic stroke, stated Dr. Bethany Van Gelpen. The scientists studied blood levels and dietary intake of folate and vitamin B12 in 62 patients who had suffered a hemorrhagic stroke and 334 patients who had experienced ischemic stroke, caused by restricted blood flow to the brain. The results showed that higher folate levels were associated with a reduced risk of hemorrhagic stroke. There was no significant link between folate levels and ischemic stroke, nor did a diet high in vitamin B12 show any connection to any type of stroke. Number 4. Salmon. Salmon is considered a lifesaver in stroke prevention, as it is an excellent source of omega-3 fatty acids. These fatty acids help regulate blood pressure and reduce bad cholesterol levels in the body. In an older study, consuming 2 servings of farmed salmon per week increased omega-3 levels in the blood by 8 to 9% and decreased omega-6 levels after 4 weeks. Additionally, some studies have shown that regular fish consumption may be associated with lower triglyceride levels and improvements in other risk factors for heart disease. Eating salmon regularly improves cardiovascular health and supports stroke prevention. Besides salmon, you can also consider other fish like herring, mackerel, and tuna. Although salmon offers many health benefits, overconsumption may have adverse effects. Nutrition experts recommend eating salmon 2 to 3 times per week for optimal results. Eating too much fish may lead to toxicity, as fish can contain relatively high levels of harmful substances such as arsenic, mercury, dioxins, and other toxins. Additionally, always cook fish thoroughly to avoid potential infections from parasites like worms. Number 5. Legumes. Legumes are not only rich in fiber but also high in protein, which helps you feel full and satisfied, reducing the likelihood of overeating other foods. They are also packed with potassium, magnesium, folate, and other phytonutrients that are associated with lowering blood pressure and improving cardiovascular health. Consuming just half a cup of cooked legumes daily can lower cholesterol levels. Like all high-fiber foods, legumes contain soluble fiber that binds cholesterol and prevents its absorption in the gut. As fiber ferments, it produces changes in short-chain fatty acids that can inhibit cholesterol formation. Other components in legumes also contribute to lowering cholesterol levels. They are low in fat and contain important phytochemicals that help protect against heart disease. For example, legumes are rich in flavonoids, a compound also found in wine, berries, and chocolate, which inhibits platelet aggregation in the blood, reducing the risk of heart attack and stroke. Some legumes you should include in your diet to prevent stroke and cardiovascular disease are soybeans, kidney beans, lentils, green beans, and black beans. Number 6. Ripe tomatoes. A long-term study conducted on 1,000 men in the Netherlands, led by the Stroke Center at Duke University, USA, concluded that people who regularly consume tomatoes are less likely to suffer from strokes. The study participants were divided into 4 groups based on their tomato consumption levels. The primary focus of the research was lycopene, a potent antioxidant found in ripe tomatoes that is known to reduce the risk of cardiovascular disease and strokes. At the start of the study, participants underwent blood tests, and after 12 years, they were re-evaluated for cardiovascular health. Among the group with the lowest lycopene levels, 258 people, 25 individuals experienced strokes. In contrast, only 11 individuals in the group with the highest lycopene levels, 259 people, had strokes, a 55% reduction. According to Dr. Harry Gostein, the study's lead researcher, lycopene's main advantage is its ability to protect cells from damage caused by free radicals, harmful molecules produced during digestion, and by environmental factors like cigarette smoke and radiation. Lycopene's most significant benefits include reducing inflammation, blood clots, and stroke-causing agents. This compound is also what gives tomatoes their red color, and other red fruits such as red peppers, papayas, and watermelons also contain lycopene. However, the lycopene content in tomatoes is considered the highest. Compared to taking lycopene supplements, consuming fresh tomatoes directly provides greater benefits. Number 7. Grapefruit. Reduces the risk of ischemic stroke. According to the American Heart Association, citrus fruits like grapefruit contain flavonoids that can reduce the risk of ischemic stroke in women. Ischemic stroke occurs when blood flow to a part of the brain is reduced or blocked, preventing brain tissue from receiving the oxygen and nutrients it needs. Regularly consuming grapefruit is generally safe and should be part of a balanced diet. Experts recommend eating half a grapefruit daily, enjoying it as a snack before meals, or drinking it as juice. Grapefruit contains naringenin, a powerful antioxidant that helps burn excess fat and maintain a stable weight. It also aids in blood sugar control and reduces the risk of cardiovascular diseases, making it particularly important for individuals at risk of obesity. If you're looking for stroke-preventing foods, grapefruit is an essential addition to your diet. Number 8. Lemon. Reduces the risk of ischemic stroke. Lemons contain flavonoid antioxidants, which may reduce the risk of ischemic stroke. Lemons are highly nutritious, providing fiber, vitamins, minerals, and low calories. A single lemon contains 18 calories, 5 grams of carbohydrates, 2 grams of fiber, 31 milligrams of vitamin C, 13 micrograms of vitamin A, 15 milligrams of calcium, 5 milligrams of magnesium, and 2 micrograms of beta-carotene. Some studies suggest that lemons can lower stroke risk. Diet is one of the factors that influence stroke risk. Adjusting lifestyle and eating habits, including consuming citrus fruits, can be helpful. A 2012 study from the University of East Anglia, UK, involving over 69,600 women, found that flavonoids in citrus fruits like oranges, lemons, and grapefruits could reduce the risk of ischemic stroke in women. Increasing flavonoid intake, a subgroup of flavonoids, further enhanced the effect. In 2016, an analysis of 11 studies involving over 356,000 participants by scientists at Nanchang University, China, revealed that higher dietary flavonoid intake was associated with a lower risk of stroke. Flavonoids are abundant in citrus fruits, berries, such as strawberries and blueberries, and leafy green vegetables. Flavonoids offer anti-inflammatory and antioxidant benefits, improve endothelial function through specific compounds, reduce platelet aggregation, and regulate blood pressure. Their antioxidant mechanisms decrease lipid peroxidation and oxidative stress, which can lead to heart disease and stroke. A 2019 study from the University of Southern Denmark, conducted on 56,000 people, showed that higher flavonoid intake correlated with lower rates of ischemic stroke, heart failure, and stroke-related deaths. Researchers also linked higher flavonoid consumption to reduce mortality from cardiovascular diseases and cancer. For cardiovascular-related and cancer-related deaths, the recommended daily flavonoid intake was around 500 milligrams and 1,000 milligrams, respectively. Smokers and heavy drinkers benefit even more from increased flavonoid consumption. Lemons are generally safe and can be added to daily water intake. However, individuals with acid reflux should limit lemon and other citrus fruit consumption, as they can worsen symptoms. People with mouth ulcers should avoid lemons, as their acidity can aggravate the sores and sometimes cause enamel sensitivity. Additionally, individuals with citrus allergies or sensitivity should avoid lemons and citrus-containing products. Number 9. Bananas. Eating a banana for breakfast, lunch, and dinner can provide the body with a rich supply of potassium, reducing the risk of brain blood clots by approximately 21%. Researchers from the UK and Italy suggest that this finding could encourage people to prevent strokes by consuming potassium-rich foods such as spinach, nuts, dairy, fish, and bananas. Previous studies have shown that bananas help control blood pressure and prevent strokes. Each banana contains around 500 milligrams of potassium, which is highly beneficial for maintaining stable blood pressure. A potassium deficiency in the human body can lead to symptoms like irregular heartbeats, discomfort, nausea, and diarrhea. Consuming about 1,600 milligrams of potassium daily, equivalent to eating 3 bananas, can reduce the risk of stroke by more than 20%. Researchers from the University of Warwick, UK, and the University of Naples, Italy, report that in most countries, potassium intake is significantly lower than recommended levels. Overall, increasing the consumption of potassium-rich foods could help prevent over 1 million stroke-related deaths worldwide each year. Taking care of your health through daily meals is the most effective way to protect yourself and your loved ones from the risk of strokes. Which food on this list is your favorite? Share your thoughts in the comments below. Don't forget to hit like and subscribe to our channel for more valuable health tips. Wishing you good health and happiness.